Now to that important health warning for parents about kids and snoring. It could be a sign of a more dangerous problem, and Paula Ferris is here with one family's eye-opening story. Good morning, Paula.
Good morning to you, Robin. You know, we're talking about sleep apnea, something you typically associate with adults, but children suffer from sleep apnea, yet many times they're misdiagnosed. And snoring could be your first clue.
They're so cute when they're sleeping, and they're so funny when they snore, right? Maybe not.
Let's say my child snores. Should I be concerned?
It should raise a flag, and you should think about watching some other signs and symptoms that sound the alarm. We just wanted to talk a little bit about how you're doing.
Dr. Sydney Butts is an ear, nose, and throat doctor who sees a lot of young snorers and says all that cute snoring could be a sign of something serious.
Children can have sleep apnea?
Definitely. It's not a problem restricted to adults, and it's actually one of the most common reasons why children need their tonsils and or adenoids removed.
Is that good, Kaden?
But it's not always that easy. When Amanda and Kevin Cook brought their newborn home, he seemed to be a healthy infant. But about 3 months in, baby Caden began to have episodes during which he'd stop breathing.
Just completely limp, non-responsive. I would hold him and say, Caden, 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 and finally, and he'd start breathing, and it just got worse and worse.
At 6 months, a sleep study showed that little Caden had not one, but 2 kinds of breathing disorders. They found obstructive sleep apnea, which occurs when something is blocking the airway, such as tonsils, and central sleep apnea, which occurs when the brain does not give the body a signal to breathe. It isn't uncommon in newborns, but Caden was past that stage and not getting better. His tonsils were not enlarged, so even surgery wasn't the answer. Aside from snoring, other symptoms of sleep apnea in children include hyperactivity, trouble focusing in school, depression or anger, and even bedwetting, symptoms that can sometimes be confused with ADHD, attention deficit hyperactivity disorder, and can cause kids to be misdiagnosed.
Many kids may get labeled as being hyperactive, and I think it's important to look at a variety of different causes that could be contributing to that. It may not be that sleep is the only cause, but if there's a worry about the child's sleep, it should definitely be investigated.
And that's where that misdiagnosis can come into play. Again, those symptoms can mirror ADHD, such as hyperactivity, poor academics. But we don't want to be alarmist. Just because your kid snores doesn't mean they have sleep apnea. And if they have sleep apnea, doesn't necessarily mean that they're going to snore. But if you suspect your child does have sleep apnea, you want to speak to your pediatrician. They'll facilitate a sleep study. And Robin, I know you're going to speak with Dr. Ashton about this, but typically the way you treat kids with sleep apnea, removal of tonsils or adenoids, much different than how you treat adults.
That's right. Thank you much. And I love how you're becoming our snoring expert.
I know. How did that happen?
I don't know. The connection there. I know. But yes, Jen is back with us. And so talk about what we're seeing here. This is a child's CPAP.
Child CPAP machine, which stands for continuous positive airway pressure. And the way this works is you wear it on your face. The kids' versions have actually kind of some nice cartoons and colorful colors. They're kid friendly. And it blows a low degree of continuous airway to the upper airways so that those structures can't flop down and cut off the breathing.
Do you have any suggestions for parents who have to put this on their child?
Look, I empathize and sympathize because it's hard to get kids to brush their teeth. This could be even harder. I think the first tip is to familiarize yourself with the CPAP, get them comfortable with it, have them try it on when they're awake, and then have them ease into sleeping with it, and then stick with it. If they rip it off or knock it off during the night, put it back on. And it's very, very important. You need to explain to them once they're at the age of reason, they do need to keep the mask on, and it will make them feel better during the day. So older children will gradually learn to understand.
Now, what other conditions can cause this type of snoring?
Well, you know, it's interesting. We heard about it being misdiagnosed as ADHD or ADD, but seasonal allergies, hay fever, any potentially upper airway infection can cause similar symptoms. The key is that it's acute, it's short term, and it will resolve with treatment. So ideally, you start with your pediatrician. They will then triage, does this child need a sleep study, or do they need a visit with a specialist like an ear, nose, and throat doctor if possible.
But talk a little bit more about the misdiagnosis and why is that?
Well, look, it's easy when you can connect the dots between a symptom or sign and an endpoint or a manifestation. It's not so easy when they're removed. So we have to remember to think holistically. just because something's going on during the day doesn't mean it doesn't have its origin at night. So again, think of the whole person.
I love how people are just bouncing, just nodding along and agreeing.
Everyone's
to
tired.
Kind of a lot of what you're saying, agreeing with you.
Thanks,
all right,
Robin.
Jen, thank you. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.